Welcome to the Sniff Spotlight Series, your one-stop shop to find out what's really going on in sniffs nationwide. I'm your host, Yitz Rubin, and this is sponsored by Renewal Rehab, the best therapy provider for sniffs nationwide. Welcome to the Sniff Spotlight Series, and welcome Lee Tuchfarber with Renew Senior Communities out of Denver, Colorado. So Lee, thank you so much for being on the show. So tell me about your transition from the real estate industry into senior communities about 12 years ago.
I worked as a commercial real estate broker, and in 2008, I was looking to pivot into a new sector within real estate and ended up diving into senior housing. And one of the things that I learned was that it's really not about the real estate. That just really sets the stage for sort of the operations piece and what the actual customer experience or the resident experience is. And that's really the core of what senior housing is about. So
how are you transforming the traditional model into something more innovative?
it's really a combination of things. It's kind of a stack of elements that when put together, it's quite powerful. So one thing is that I look at senior housing and what we're doing is I look at Renew as a broad banner healthcare company in general. And therein, we're interested in creating a wonderful environment for seniors, but above and beyond that, also collaborating with major research institutions and really looking at ways that we can actually conduct research on site, so measure certain key metrics, baseline metrics, and then track and trend over time. And then, measure the results of a given program, whether it's durable, sort of longer term intergenerational collaboration that's well structured, or something related to animals and sort of the therapeutic effect that's been pretty well researched. It's really a combination of research and the experience of, working with animals and working with the children and combining those two elements and then measuring the results with the idea that, as we move forward, we would be interested in publishing a study and just sort of contributing it back to the scientific world for other operators, other people interested in, furthering based on that research.
That's fascinating. It seems like you guys are really focusing on the clinical research and making sure that you're getting the best out of that and then giving that out to the industry. So tell me about your dream team and how does their knowledge help change the bigger picture?
The formation of Renew was, the intention was really to go out there and find great, very accomplished individuals in operating senior housing communities, but also combine with that a blend of professionals, credentialed professionals from outside the industry that can enable our company to really import new ideas and truly innovate. It's harder to innovate when someone has been doing something, for decades. So it's kind of this collection of inside the industry and then outside the industry professionals. Some of those professionals would include our managing director has been operating for 40 years or so and has run about 210 communities over the course of his career. So he's very, very good. And then, we have another person in operations that has been doing it for about 35 years as well. And just combined, there's so much experience there. But then, we also begun working with the neuropsychologist for the Minnesota Wild and the Minnesota United, who has a whole array of interesting skills. I mean, as a PhD, number one, she has a background in working with dementia patients prior to joining the NHL. Her name is Dr. Sonia Moshe, and she can really nicely structure on-site trials or on-site research. She's also an expert in positive neuropsychology, which is basically training, elite athletes to overcome obstacles. And that has come in very handy during COVID when, we don't have elite athletes, but we have elite leadership and we have elite, caregivers, and they function as a team. And so they can benefit from really the same kinds of principles and sort of reframing things during a very difficult period of time. We've also been collaborating with a former Olympic triathlon coach. Her name is Gail Bernhardt, and she brings, fitness and diet principles from the sort of elite training, Olympic training field, and bringing that in and adapting it to seniors in various ways. And so that really allows us to nicely get out of the box. We've also been working with a Zagat 30 under 30 chef out of Charleston who's worked underneath Michelin star rated restaurateurs and James Beard Award winning chefs. So she comes with great restaurant experience, and that can be very beneficial for the senior housing domain, which is notorious for not having the most interesting and the best food. So when you combine all these professionals together, there are some interesting sort of ideas that really stick and elevate the value proposition for residents and their families.
That sounds very interesting. It's definitely out of the box, especially in the elder care community. So tell me about your collaborations with universities and the research you guys are doing.
The research has been in a couple different domains. One is actually related to digital healthcare technology, and we attended CES, the Consumer Electronics Show in Las Vegas, prior to the pandemic, where we were able to interface with a whole array of healthcare technology companies from all over the world. One of them in particular that we helped to develop use cases for and really pilot their technology was inventor of this sort of iPad-based augmented reality software that it's really a 10-minute test for someone in, say, their 60s who feels and looks fine, but actually might very subtly in the very early stages be on track for AD, Alzheimer's disease. And this is a very highly reliable FDA approved device that can tell a person they might have just lost their keys the other day, but otherwise they're fine, but they can actually be on track for Alzheimer's disease. And if they are, and it's discovered, then there can be an earlier intervention and help slow down the progression of what is apparently occurring in their brain. So, that was a technology that we piloted. As far as, with universities, we've worked quite a bit with Dr. Tim Boyd out of the University of Colorado, who is bringing a drug called Leukein through a series of trials. It's very promising. We brought him in. He's done a series of lectures to pretty large audiences in our building. There's a big high quality lecture / public education element to what we do. It's great because, it's just a way for us to, in a very sort of significant fashion, contribute to that scientific effort, which is the place where we want to be.
What have been some of the key issues you feel team members are coping with during COVID?
We surveyed our staff, and there were really 15 to 20 different issues that were pretty common across the board. It was really a range of personal at home issues and then, professional issues. People were just in a very continuous stressed out state. Some of their husbands had lost their jobs. Kids were home from school. Communication issues. Once we conducted that survey, we realized there is definitely a broad range of issues, and our response to that was to put support groups together and work with Dr. Moshe on wellness workshops that we'd put together to allow people to express some of the challenges they're going through and share them with other staff in small groups and help abate what they're experiencing.
How do you vent and reframe, sort of change your perspective and build a muscle to help cope?
Well, this is actually something that Dr. Moshe brought to us. She brought some great concepts in, and one of them is when an individual is going through a very challenging experience, you get the best of them, and people can turn negative and just think this is never going to end. The change of frame there is, going through a challenge or a struggle is actually a time when someone builds strength, builds muscle, builds resilience, and you come out better for it. And so in that respect, when you look at COVID in that way, you realize, wow, when we come out of this, we're going to be better people. We're going to be transformed in some good ways. So that was really helpful.
Thank you so much, Lee. It's been a pleasure and an honor. I really appreciate you joining the Sniff Spotlight series.
Likewise, pleasure.
Thank you for sharing this tremendously important part of senior care. The Sniff Spotlight series highlights healthcare heroes and thought leaders in the skilled nursing community. We're building awareness, trust, and shining the light on SNFs. So stay tuned. Remember to like, comment, and share.